Hello, my name is Sarah, and today my colleague Tarana and I will be presenting the naturalistic pilot study comparing the feasibility of applying SIP versus PST versus waitlist control in patients suffering from late life depression during COVID-19. The current COVID-19 pandemic has led to strict social isolation recommendations, disproportionately affecting the elderly population. While these public health measures are necessary, the social isolation has led to higher self-reported rates of anxiety, depression, and loneliness among seniors, and has been associated with the development of numerous physical health conditions, increased all-cause mortality, and decreased quality of life in the elderly. For these reasons, it is crucial to find easily accessible and effective geriatric mental health interventions without increasing patients' risk of exposure to COVID-19.
The Student Senior Isolation Prevention Partnership, SIP, is a national initiative that partners medical students with older adults in the community to provide social support through weekly phone calls. Based on anecdotal evidence, SIP has been successful in fostering meaningful relationships in an attempt to prevent the effects of social isolation. Formal psychotherapy interventions, such as problem-solving therapy, PST, have also been shown to reduce depression and rates of suicidal ideation in adults aged 60 or older suffering from late life depression, by increasing their ability to cope with stressful life events. However, to our knowledge, PST has not been attempted using telephone delivery of the service during the COVID-19 pandemic. Our study will also implement a waitlist control where participants will continue their pre-existing care over the 12-week period without receiving SIP or PST. The COVID-19 pandemic has precipitated limited access to psychotherapy due to an increased need and a limited number of trained professionals available to deliver these services. A student-led initiative such as SIP could provide a more accessible form of geriatric mental health support. We hypothesize that it will be feasible to conduct an RCT of telephone-based SIP in comparison to PST and a waitlist control under the current constraints imposed by the COVID-19 pandemic and the need for telephone delivery of these services. Also, we hypothesize that it will be possible to collect effect size estimates on self-reported symptoms of depression, anxiety, isolation, and resilience in community-dwelling seniors.
Participants will be eligible for this study if they are a community-dwelling senior age 65 or older, suffering from an episode of major depression. They must be willing and able to receive services delivered over the telephone and have adequate understanding of written and spoken English. Participants must also endorse feelings of loneliness or isolation. Participants will be excluded if they have pre-existing dementia as evidenced by a score of 17 or less on the telephone MoCA, have a history of schizophrenia, bipolar disorder, personality disorder, or suicide attempts or threats. This study will be an open-label, randomized controlled trial comparing 12-week telephone-delivered SIP and PST in a total of 45 participants. Participants will be recruited from the Division of Geriatric Psychiatry and the Geriatric Mental Health Program and randomized in a 1-to-1-to-1 ratio to either SIP, PST, or a waitlist control. REDCap will be used to achieve randomization and its concealment. Statistical analysts will be blinded to group allocation during data analysis. Prior to enrollment, trained research assistants will perform a pre-screening of potential participants' charts, administer the telephone MoCA, and conduct the Columbia Suicide Severity Rating Scale to ensure the absence of exclusion criteria. Participants in the intervention groups will receive SIP or PST delivered via telephone as a weekly 30 to 60-minute session over the 12-week study period and as an adjunct to their current therapies. At weeks 0 and 12, all participants will complete the PHQ-9, GAD-7, Lubin Social Network Scale 6 to assess loneliness, and the Connor-Davidson Resilience Scale 10 to assess resilience, in addition to a medication assessment to determine changes made during the study period. The primary feasibility outcomes listed will be collected throughout the study and totaled at the end of the study period. A secondary outcome will be determining the extent of change in self-rated depression, anxiety, isolation, and resilience based on the validated scales administered at weeks 0 and 12 of the study period.
Study recruitment will begin in November of this year. We expect the study will demonstrate that it is feasible to conduct an RCT of telephone-delivered PST versus SIP for community-dwelling seniors in the London area, and delivering PST over the phone will reduce the risk of exposure to COVID-19. This study will also inform if it is feasible to conduct a future large-scale RCT that could determine if telephone-based services such as SIP and PST are effective for improving geriatric mental health. Future studies may also help to determine if student-led initiatives have the potential to fill the need for more accessible geriatric mental health supports. Thank you for listening.